Today we're going to be going over transferring a patient from the bed to the wheelchair. So to begin, we're going to recite our 7 steps. So number 1 would be to check the physician's order. Number 2 would be to wash your hands. Number 3 would be to organize your equipment. Number 4 would be to identify the patient. Number 5 would be to introduce myself. Number 6 would be to explain the procedure. And number 7 would be providing privacy for them. Alright, so prior to coming into the room, I'm going to identify the patient using 2 identifiers. Hello, how are you today? Do you mind if I just see your wrist really quick? Alright, can you tell me your first and last name and date of birth, please? Alright, perfect. Thank you very much. And then the second identifier will be to check the MAR or whatever physician's order, compare that to. Right? So the first thing that I'm going to do is I am going to assess their mobility, right? So their strengths. So you're just going to feel my hands on your legs, okay? And I'm just going to need you to press up, right? So just kick up. Alright, thank you. Now you're going to feel my hands at the bottom of your feet and just with both feet pretend like you're stepping on the gas, okay? Alright, perfect. Thank you very, very much. So it seems that you have a little bit more weakness on your left side. So I am just going to put your wheelchair when we're moving you onto your right side, okay? Alright. So the next thing that I want to do is make sure that they're safe. So I'm going to lock the bed into place on all 4 sides. Lock, lock, and of course you're going to want to lock the wheelchair. Lock, lock. Okay, so the next thing that I'm going to do is we're just going to make sure they're lowered all the way to the bed, to the ground, and obviously they are already. So we're going to ask them to scoot to the edge and make sure you're here to prevent any falls. Alright, can you scooch over a little bit? Okay, that's perfect enough. Thank you. And now I'm just going to raise the bed about 30 degrees. Alright, perfect. So the next thing that you want to do is you're going to want to assist them upward and over to the side, right? So you're going to feel my hand behind your back, okay? And you're going to feel my other hand go right underneath your knees, okay? And on the count of 3, we're going to pivot you over to the side, okay? 1, 2, 3. Alright, perfect. If you could just fix yourself up. Alright, can you place your hands into the bed? Okay, perfect. How are you feeling? Do you feel dizzy, lightheaded?
No.
Alright, perfect. So the next thing I'll do is I'm going to put their robe on. And we're just going to make sure they have their slip-resistant socks. There we go. Alright, so next you're going to spread your legs a little bit, please. And you are just going to have my foot be in between them, right? So we're going to try to lift you up from the bed into the wheelchair, okay? So what I want you to do is you're going to put your hands on my shoulders, right? And you're going to feel my hands on your waist, okay? Alright, so let's get set up. You can put them around, thank you. And on the count of 3, we're going to lift up, okay? 1, 2, 3, up. Okay, so we're going to pivot over to the wheelchair, right? Okay, slowly. Okay. Do you feel the wheelchair behind you? Alright, perfect. We're going to start lowering you down, and you can reach for the side hands. Okay, perfect. You want to make sure that they're in place, they're locked, and we're going to make sure they're perfectly good. Alright, you are all ready for transport. Take care, alright?
Thank you.